Okay. Namaskar. Ahara, Arogya, Adhyatma, the light of Samskara. Welcome to the light of Samskara. Today, being the International Eye Donation Day, we have the most renowned ophthalmologist, Dr. Suresh Babu, who heads the Cornea Center in Minto Hospital, and he is the medical superintendent. He has been doing the selfless service and he has earned a name as the most devoted, dedicated ophthalmologist in Minto Hospital, which is a regional institution training the postgraduates also. So, this is the best center in the whole Karnataka. Sir, welcome to the Ahara Arogya Adhyatma show, sir. Namaskara.
Welcome to everybody.
Sir, please let us know what exactly is the eye donation and who has to do it and how it has to be done. Please let us know, sir.
Eye donation can be done by anybody. We collect eyes from only dead persons. No eye is collected from a living person. From the age of 2 years up to the age 100 and even 100 plus years, we can collect. And this is collected usually 6 to 8 hours after death. So there is no monetary transactions involved in eye collection.
Yeah. That is really nice because this dana means, it is the donation. It is not like the money that you donate. This is literally giving the light to the so many people. So if a person donates, I mean, the family people donate the eye. So how many people will get the eyesight with this, sir?
A minimum, a pair of eyes will give vision to 2 persons. But recently, newer techniques have been developed in the last 15 to 20 years, where we can do lamellar surgeries. That means the anterior part of the eye can be used for one person and the posterior part to the other person. So a minimum four persons can get some sort of vision to this death from a pair of eyes. So this is really helpful for 4 people in minimum by a cause of this death.
Okay, sir. That's really nice. That means, one person, if he donates, the 4 people are getting the vision. And that is really a nice thing, sir. But one thing, everybody thinks that eye donation means the whole eye is taken from the socket. Is that true or only a part of the cornea is taken, sir? What exactly is it?
The older techniques used to be there that the whole of the eye used to be taken and it used to be brought to the eye bank and where it used to be processed. Nowadays, we have got better preservative medias. So only corneal scleral button is taken from the place where the eye is being enucleated, and that button is placed into the media and brought to the eye bank and processed. So it all depends upon what type of procedure that the eye bank is following. Depending upon that, either the whole eyeball is taken or only the corneal scleral button is taken.
Yeah, I think that is a good thing. If the only cornea is taken, there will not be deformity of the eyes, So the people will not feel that something is wrong with the dead body. I think that's also a good idea. And one more thing, sir. There are stories, like a mother donating her eye to the son, and the son thinking that the mother is ugly because she doesn't have one eye. Such stories, I mean, I don't call it a cock and bull story. It is like a cock and bull story only. So is that true?
There's no truth in that. We do not collect any eyes from a living person. That is first thing is only after the confirmation of the death, then the eye donation process starts. Second things, even people do not get any transplantation done from other animals also. It's only human eyes that are transplanted. These two myths have to be taken out of this system.
Mind.
So we need to say that only after the death, eyes are being transplanted.
Correct, sir. And one more thing, sir. In the Sanatana Dharma, Dana has got a special place. Once upon a time, Annadana was supposed to be Shrestha. Now, Kannu Dana, now we have the liver and we can donate anything and everything, right from the valves to the heart, and every thing in the body can be utilized. But when it comes to the eyes, Is there any restriction from any other religions? Is there a forbidden thing, sir?
As per to my knowledge, there is no restriction from any religion to donate eyes. Even eyes are being collected from all religions. Buddhists donate lot of eyes, Jains donate lot of eyes, Hindus are also donating, and in Muslim countries, lot of keratoplasties are being done. So lot of donations occur even with Muslims. So there is no truth saying that any religion is barring eye donation at all.
Okay, sir. Now that is really nice, because unless this awareness is brought, the fear will be there, and that fear psychosis prevents the people from coming for the donation. So once they pledge, how many centers are there in Karnataka to pledge, sir, or in all over India?
All over India, there are around 500 eye donation centers. We plan to increase this to nearly 2,000 eye donation centers all over India. We need to
Okay.
have around 500 eye banks in India to cater to our needs. But
Hmm.
just simply having an eye bank will not suffice our
Solve.
needs. We need a
Yeah.
functioning eye bank. An eye bank is
Correct.
called as a functioning eye bank when it starts collecting around 250 pairs of eyes. That time only
Okay.
we can say that it's a good eye bank. Right now, most of
Okay.
the eye banks are collecting only 100 to 300. Very few eye banks, about 10 to 12 eye banks, are collecting more than 1,000 eyes per year.
Okay, okay. It is not just the collecting that has to be utilized also in time. So once the death occurs, what is the time gap or the time lag within which the eye has to be transplanted, or what is the method, sir?
Uh, Usually within the after the death, nearly 6 to 8 hours are given before we can enucleate the eye. Once
Oh,
we enucleate the eyeball or the corneoscleral button is transported in several medium. If it is kept in
okay.
moist chamber medium, we have to
Hmm.
utilize it within 24 hours. There is
Okay.
another called as McCarry-Kaufman media, where
Hmm.
if the corneoscleral button is kept in that, we can transplant that corneoscleral button within 72 hours. If it is
Hmm.
kept in cortisol media, then we
Hmm.
can use the tissue within 14 days. So that
Oh,
gives us
I
ample
see.
number of time for us
Time.
to transplant this eye, because we can neatly arrange our recipients, also give them time to travel from their place, get admitted,
Yeah.
and all the tests to be done before it can be transplanted.
Yes,
So
yes, yes.
now with the advancement of technology, we have got better media for us to
Preserve it.
preserve this tissue and transplant it.
Okay, that's really nice, sir. Otherwise, after collecting, if the recipient doesn't come, and then there is a delay, and it used to be waste. But suppose you have collected 100 eyes. Can you use all of them, or some of them are used for the postgraduates for their hands-on
Uh,
training, sir?
as per our statistics on statistics of India, nearly only 40% of the eyes are used. Why only 40%? Why not? Why is it not going to 100%? I have to say this one thing: each and every eye that is collected undergoes a strict processing. This thing where all eyes are strictly evaluated whether these are of transplantable quality or not. Second, the person who donates the eyes are tested for serology. If any
Hmm.
serology is there which can spread to the other the living person, then such eyes are not advocated for transplantation. And third, the patients are died from certain diseases like septicemia and rabies or etc. Such eyes are not suitable
Taken.
for transplantation. So we will
Okay.
rule out these things from the system. And some eyes we do not know the cause of death. Even when the cause of death is not known, such eyes are not transplantable. So all
Okay.
these eyes are not wasted. These are used for postgraduate training. The new postgraduates who are in the medical college, they use this eyeballs as a training eye for their surgeries.
Okay, sir. And suppose that somebody had the HIV/AIDS or the corona, are they contraindications, or they can be taken? Because the
Their
cornea
absolute
doesn't have
contra
the blood supply, so.
There are absolute contraindications, because not only collecting the eye, we also collect their blood samples. So
Correct.
it is for transplantation, and it's an absolute contraindication. But we can use this for research purposes. Okay, we can do
Okay.
histopathology on them. We can do check out what is happening behind the eye, inside the retina or the vitreous, and do histopathology on this. But for transplantation, both HIV and corona is an absolute contraindication.
That's nice, sir. And another thing I wanted to ask, sir, regarding the corneal transplant. Many people have got the myth that it is going to cause a problem or something. Is it true that the people have to fear about the donation or fear about getting this thing? And what are the indications, like in the recipient? Are there any contraindications where everybody can be receiving the cornea?
No, the cornea is an avascular tissue. Anybody can receive a cornea, this avascular tissue. But the only problem is before transplanting, we will check whether if we transplant this transparent structure, that is the cornea, whether the patient has got visual potential or not. If there
Correct.
is no
Whether
visual
the optic
potential,
nerve is also normal.
yeah, the optic nerve is normal. There is no glaucoma already existing which has killed the optic nerve, or there is no retinal problem which is causing the problem of vision being regained. So with all this keeping in mind, and also other things are also checked, like the patient is not having very bad dry eyes, or the patient is not having lid deformities, because all these are very important for the successful transplantation. After the
Yes, sir.
transplantation, the graft survival depends upon not only the healthy cornea, but also the tears, the lids, the optic nerve, the retina, and the intraocular pressures. All this also form a part
Very
of the
important.
successful transplant.
Very, very good, sir. Now that if the patient willingly, they have already registered their donation, and the relatives, the children will be knowing that. So, what are the advices? How you want them to preserve the eyes till you go and collect the eyeballs, sir?
First and foremost, I would like them to inform the nearest eye bank that the patient, that their kith and kin has died because of certain disease, and that is their age, and they would like to donate their eyes immediately. So the next thing that we would like them to do is switch off the fan where the dead body is kept, keep the eyes closed, and keep a cold pack on the forehead, and raise the head a little bit, and prevent the sunlight from falling onto the body. If they can assure doing all these things, this will help in prolonging the viability of the corneal tissue.
Okay, sir. So thank you very much for all the information that you have given. And in fact, I'm 75, and by listening to you, I'm inspired to donate my eyes. So I will register with the Minto Hospital so that, after my death, the eyes will come to the Minto Hospital. And you are doing the great service. And thank you very much for all the kind information that you have given to the viewers. And thank you very much, sir.
Thank you very much, madam, and
God bless you,
hope
sir.
all your viewers pledge their eyes and promote the awareness of eye donation.
Yes, sir. Even after the death, if the eyesight has to be remain in someone else, that is the greatest thing. So, Sarthaka Jivana, we can call it. Thank you, sir. Thank you very much.
Thank you, man. Thank you.